Good evening. Happy St. Patrick's Day. This is green. There's the only thing I have that's green, I think. I have a green coat I could wear, but didn't show well. So wearing my Bavarian hat that I actually did buy in the Alps a few years ago. So got some show and tell to do before we answer our usual questions. So blood pressure, obviously one of the biggest risk factors for having vascular disease, so something that you should be able to monitor at home. I've routinely recommended the Omron Evolve in the past. This is still one of my favorite blood pressure monitors for people at home to utilize. It has a Bluetooth sensor in it so that it records all your data on the screen and then sends it to an app on your phone. And then I often have patients then send me their reports and we can look at them. But a newer device that just came out about a month ago, the Connect QT. It's a device from a company that also makes the Aktia device. That's the device I use in my office that looks at not only your brachial pressure, which is the blood pressure in your arm, but also looks at your central aortic blood pressure. That's the blood pressure as it comes out of your heart, goes up to your brain, into the rest of your organs. So that's the true blood pressure, is your central pressure. So when I was still an invasive cardiologist, I'd thread a catheter up your radial artery or femoral artery and measure it in your heart. Probably don't want me doing that anymore. So this is a way non-invasively to check it. And I've looked at this device and compared it to the one I have in the office, and the values exactly match up. So that's the two cuffs I usually recommend most people consider. I'm now getting a lot of questions about the watches and such. There are no, other than the Omron watch, there's really no watches in the US that are super accurate. There's a lot of devices you can buy on Amazon or overseas that can give you ballpark close, but they're generally off. This is Blood Pressure Doctor, and I also have the YHE device. This one tends to be a little bit more accurate. It has a little air bladder in it and pumps up and includes your radial artery and then gives you a blood pressure, but it's usually a little bit higher than what your brachial pressures measure, but it's decently accurate for myself. But I've been anxiously awaiting the arrival of the Aktia device. The Aktia is a band that uses photoplasmography light to measure your blood pressure non-invasively from your wrist. It's not yet in the United States. It's in Europe and Canada. But I had a patient come in to see us at Apollo Cardiology last week who had an extra one, and he was kind enough to leave it with us. So I've been playing around with it. So it's nice form factor, very comfortable, don't feel it at all. Aktia device, that's how you spell it, Aktia. Not yet in the US. You can go to their website and sign up for their wait list, and they'll email us when it's available. It's pretty straightforward to set up. Once I was able to download the app, I'll tell you about that in a second. But you basically do a blood pressure with its included brachial device, and then I think that calibrates it, and then you just wear the band, and then it looks like it's recording at least every hour of blood pressure. So I have a graph throughout the day. I just got it fired up and working Saturday afternoon, so I had yesterday's first full day, and then have some nocturnal blood pressures. And so far, working well, showing my blood pressure appropriately dips while I sleep. So you want your blood pressure to drop at least 10% while you sleep. So short answer is that, it's, not FDA cleared yet here. Because of that, the app is not in the US Apple Store. So it is a little bit of a workaround. You have to create a new Apple ID that has a European address, download the app, and then log back into your US account. It's a little bit harder than I just explained, but if you're pretty tech savvy, you can figure it out. So once the app's on your phone, it works without you having to be logged into a European Apple ID account. And so I'm playing around with it. But hopefully it'll be about sometime in the next few months, because it was supposed to come out in 2024. So I'll let you know more details about it as I get some more data from it. But so far, so good. All right. So first question up tonight, is LDL something to worry about if you eat an animal-based diet, I assume, and live a healthy lifestyle? So I don't know if LDL should really ever be worried about. It should be evaluated, and you should assess the health of your arteries. So how healthy is the glycocalyx and the underlying endothelium? You can do various testing for that. But if you're developing plaque in your arteries on a carotid intimal medial thickness scan, a CT coronary calcium score, or a CT coronary angiogram, then yes, you probably do want to do something to modulate your lipoproteins, irrespective of what type of diet that you're eating. But some patients, they respond differently to high saturated fat diets when they're eating an animal-based diet. Some people, it really doesn't affect their lipids at all. Other people, their lipids look like they have familial hyperlipidemia, and their LDL cholesterol goes over 190 milligrams per deciliter. So test, don't guess. You do the right testing, you can figure out, is it due to a dietary intervention that caused your lipids to change, or is it something else? But you really want to look at the health of the arteries, then that helps you determine how aggressive to modulate the lipoproteins. CT coronary calcium score of 70 with no symptoms. How fast does heart disease progress? The person's a 43-year-old woman. So at that age, that is a relatively high-risk score, even though a score under 400 is not normally considered high risk, but you're going to be at a high percentile. I ballpark top of my head, it's probably 90th percentile, where 90% of people would still have a score of 0 at your age and being a woman. Calcium scores over 400 are high risk, over 1,000 are very high risk. And I always get asked, what's the highest score I've ever seen? 7,770. But your question, how fast does heart disease progress? The calcium score test generally increases about 20% per year. You want to kind of slow that slope down by doing things that optimize the glycocalyx and endothelium, keeping oxidative stress and inflammation low, and then keeping your lipoproteins generally in the 20th percentile or lower. So an LDL particle less than 1,000, ApoB less than 70 is a place that would start. If you do those things, the plaque tends not to progress. It may actually reverse some. Person says that they have microvascular dysfunction, but lately have been experiencing headaches causing blood pressure to rise. Is this part of microvascular dysfunction? Not necessarily. It would require kind of a workup to figure out, how well your nitric oxide pathways are working. Do you have a NOS3 gene that's dysfunctional, or an MTHFR mutation, or a 9p21 mutation that increases the risk that you're going to have low nitric oxide? Do you have a lot of oxidative stress or inflammation? You can do Boston Heart Labs or Cleveland Heart Labs to figure that part out. But blood pressure is a response to not potentially having enough nitric oxide. So potentially related to microvascular disease. So somebody says, can I post the names of those blood pressure devices on my Instagram? Possibly, but it's easier if I just kind of tell you again. It's the Aktia device, AKTIIA, the Connect QT, CONNEQT, and then the Omron, OMRON Evolve, EVOLV. Does one need to take breaks from Vascanox to reduce dependence? Short answer is no. Vascanox is a nitric oxide promoter. Also helps with hydrogen sulfide to dilate the vascular system. If you're dysfunctional and you're supported with it, it's going to help. If it's helping and you stop, you're likely to go back down to your previous baseline. So you don't become dependent on it. You just wanted to use it if you need it to optimize your nitric oxide pathways. What can be done to strengthen mitochondria? This is not probably an easy answer, but the top of my head is that you need to focus on optimizing your sleep. You should be getting at least 7.5 to 8 hours of sleep. That's when your mitochondria do autophagy and apoptosis, basically repair their engines. You got to get your light signals right, so work on your circadian biology. So don't ever miss a sunrise. Limit your artificial light, particularly at night. That's what these glasses are useful for. Eat your seafood 3 to 4 times a week to optimize your DHA levels. You need DHA to be able to capture the light from your environment. And then fuel up your mitochondria with things other than food. So grounding, earthing to get the electrons, and light from outside striking your surfaces to charge, separate the water in your cells. So improve your EZ water, or structured water. What are my thoughts on coffee with cardiovascular? You didn't complete the question, but I assume you mean cardiovascular disease. It depends. If you have high blood pressure, palpitations, some people are more sensitive to caffeine than others. That's usually the question is how sensitive are you to caffeine? 6 out of 10 people are slow metabolizers of caffeine and should minimize caffeine, so keep it in the early part of the day. But if it's causing palpitations or raising your blood pressure, less is more. Then there are other things in coffee, polyphenols that are beneficial, but it depends on how you make your coffee. If you do not use a filter, then you're getting the oils from the coffee bean. Some people that affects their lipids. And then, coffee is a, fruit essentially that is in a place where there's high solar exposure. So, while I drink coffee 365, coffee is generally best drinking when you're in the environment that the coffee beans are growing. So if you are not tolerating coffee, then that's a seasonal mismatch for that individual as well. So it is individualized. I personally drink 3 cups a day. I'm a fast metabolizer of caffeine. Doesn't cause any issues with my blood pressure or palpitations, and I sleep awesome. So, I've kind of done the biohacks to figure out that it doesn't cause any negative effects for myself. All right. Any thoughts about using deuterium-depleted water to improve mitochondrial function? So DDW can help if you have mitochondrial dysfunction. It really depends on what the use case is. If you have an autoimmune condition or cancer, probably better, cost benefit than if you're just somebody who has fatigue. But if the finances aren't a problem, then don't really have a concern with people using it. But it's a couple dollars a bottle, and you have to do it for extended periods of time to deplete deuterium. So you typically want to do things where you're not building up a lot of deuterium. So eating a seasonal appropriate diet will help with that. Carbohydrates are rich in deuterium, so that's why you generally should eat them in the spring, summertime, so the sunlight can help your body clear the deuterium. And then doing activities that cause you to sweat or eliminate fluids is going to help you get rid of deuterium. Jack says CT to jaw, so can include the carotids. Do I agree and why? Depends on what your setup is. You can do it if you can get into a tub to get that way. You want to do the carotids, because you want the blood to be cooled in that location to provide it to the brain. Do I do it personally? No, because the setup I have doesn't allow me to get that deep down, and I don't have any carotid disease or any brain disorders that I know of, so I don't do it personally. What are my thoughts on a device called Avacan to help with microcirculation? I'm not familiar with that device, so I'll take a screenshot here and try to look it up and see if I know anything about it. How can you detox the blood naturally? That's what your liver and kidney are for. That's a short answer. But things that improve your redox potential, so things we talked about before, optimizing your solar exposure, grounding, earthing, focusing on getting optimal sleep. But it's also about optimizing your melanin. Melanin, is what your skin is going to, utilize to be tan, but you also tan your organs. Melanin is a very potent detoxifier. So getting proper UV sun exposure is the key. So you can use the D-Minder Pro app or the My Circadian app to help you with that. Does vitamin D get to us when walking outside and the sun is behind a cloudy sky? Yes, but it's going to be filtered, so you may not get as much. So would recommend using the apps, the D-Minder Pro app or the My Circadian app. They'll have GPS in it, so it'll know what city you are when you log on to it. And it often will have the UV index. So if your body is able to make vitamin D when the sun is high enough in your environment, it will tell you how much international units of vitamin D per minute you're making at your environment based off the weather that you're currently experiencing. Next question, is getting proper sunlight and eating seasonally, if getting proper sunlight and eating seasonally, does one need supplements? That's not enough information to know for sure, but you weren't born needing supplements or needing medications. So what kind of issues, if any, are you facing? Do you have any chronic conditions? Do you have any symptoms that you're trying to reverse? If you're doing the right circadian rhythms and you're eating a season appropriate diet, no, you may not need any supplements. Question, what is the efficiency of metoprolol in treating PVCs? I don't know the exact percentage. In my experience, I offer metoprolol often for people who have premature ventricular contractions, and it's sometimes something that may help some people, and other people it has no effect. You generally want to try to get to the root cause of the PVCs. So is it an electrolyte imbalance, potassium or magnesium? Is it a thyroid disorder? Is it anemia? But the things that I'm seeing more and more of, it's the devices. The more EMFs that you're exposed to, the more premature ventricular contractions people tend to have. So the watches where you don't shut off the Bluetooth, having your phone in your pocket or on your body, being in a room, where there's a lot of Wi-Fi routers, those are the things that tend to kick off some people's electrical imbalances. But if, removing the environment doesn't help, then beta blockers or calcium channel blockers sometimes can be utilized, but they don't necessarily completely suppress them. It may help if the PVCs are being driven by sympathetic dominance, you're having high adrenaline levels. The beta blockers can deplete that adrenaline a little bit or not pump it out as much, and so maybe will help, but I've not seen it be 100% effective. I've seen it useful in some people. And you're very welcome. I enjoy doing these things. One of the common spironolactone side effects is high potassium. Is it a good idea? Take it if usually blood tests show high potassium, sometimes out of range. So if your potassium levels are over 5 to start with, then no, spironolactone is going to be contraindicated because the risk of hyperkalemia starts increasing. With hyperkalemia, there's more risk of certain heart arrhythmias. So they may have to use other agents. If you have persistently high potassium and you're on medicines that are raising it, then they may need to look at adrenal causes of why you have high potassium. Is flaxseed as good as fish oil? The short answer is no. Your body requires EPA and DHA, ideally from marine sources. Flaxseed, if it was to convert, will only convert about 1% to fish. So the ALA in the flaxseed has to go through the conversion process to become the omega-3s that your body would utilize. Very inefficient way to get omega-3s. Question, is a plant-based diet better for maintaining cardiovascular health? Not necessarily. It depends on your mitochondrial haplotype, where you live in the world, and what your other health goals are. I generally have 3 basic rules for nutrition to start, and then it's going to be based off what your personal goals are and what your biomarkers and genetic tests show. 1, I would like you to be getting at least 90 grams or more protein a day to try to maintain your muscle mass. And you can get that plant-based if you like, but it takes more planning because plant-based sources of omega-3s aren't as bioavailable as animal-based. Getting enough omega-3s, ideally by eating seafood 3 times a week or more, and then not eating 3 hours before bed. Your best feeding window is sun up to sundown. If you do those 3 things, you're at least 90% ahead of the game. Now, if you're plant-based because that's your choice, you can do that, but you got to make sure you're optimizing your protein intake with that. Is it true that lemon water increases the thyroid hormone absorption? I have not seen that in my practice. Is there a vascular component of macular degeneration? Do you do any cardiovascular tests on someone with acute macular degeneration? There is probably somewhat of a component. So, I don't have a direct test to say, oh, if you have this test, you're for sure going to have macular degeneration. But you're always going to look at the things that affect the microcirculation. 99% of your blood vessels are smaller than a human hair. So looking at all the tests that affect your nitric oxide pathways. All right. So that's it for the questions. So the review at the beginning was that, blood pressure is important. Goal 120/80. If you don't have a device yet, the one I usually recommend people consider is the Omron Evolve. Good monitor, about $100. If you're wanting to get what I consider now the gold standard for blood pressure at home, would be the Connect QT device. It measures central aortic blood pressure, which is the blood pressure that your heart, brain, and kidney sense. This is basically the little brother to the device I have in my office, the Aktia device. So this is the way to measure your true blood pressures. And then while I've played around, I usually am a pretty good biohacker. I try to get this stuff. And if it works, I tell you. If it doesn't, I also tell you. So I buy this stuff with my own money. So the YEG device, which is a blood pressure device for your arm, or says your wrist, it's marginally accurate. It has a little bladder that blows up and occludes your radial artery. The blood pressure doctor, maybe it was accurate at the beginning. I find it completely inaccurate at this time. It's probably 40 points off. Has a blood pressure cuff. I don't see it work well. And then also has the photoplasmography, little green lights that shine out of this. And it's supposed to, quote, fast measure blood pressure. Way off. So waiting for the Aktia device to come to the United States. This is a wearable device that measures your blood pressure over 24 hours. So you see a nice graph throughout the day. You see a blood pressure drop at night. So I had a very nice patient see us at Apollo Cardiology on Friday, and he brought us a backup monitor that he had. So if you, are really kind of a biohacker and pretty IT savvy, there are ways you can get these devices into the United States, but you then have to find a way to download the app from overseas. But once it's truly available to the market, I'm on their waiting list. I'll let you guys know as well. But this will be kind of the way to really monitor your blood pressure in the future. So if you measure this and potentially continuous glucose monitor, two of the biggest variables that affect your glycocalyx and underlying vascular health. So always appreciate your guys' time and attention. Every Monday, 6 p.m. Central Time, I'm going to come back here answering your guys' questions, trying to help you guys not have heart attacks and strokes. Always enjoyed doing it. It's what I really love my job for. I was very good at taking care of people very sick, having heart attacks, but it's much more fun to prevent them in my mind. So appreciate you guys. Have a great week, and I'll see you next Monday.